So now that we've assessed the patient for any nerve tension, I'm going to explain how we would do nerve flossing. So remember, the structures that make up the nerves are different than muscle, so we can't stretch a nerve like how we would a muscle. Instead, we actually have to floss or glide the nerve through the muscle itself to relieve it of any, excessive scar tissue or muscle tightening that may be compressing the nerve and causing neurological symptoms. For the sciatic nerve flossing, I'm going to have the patient again short-seated with his legs off the table. He's going to go back into the position he was before, so he'll extend his leg, dorsiflex his toes up, shrug his shoulders forward, kind of rounding them, thinking bad posture, and then bringing his chin towards his chest. So remember, this is for tension. If I wanted to floss, I'm going to have the patient bring his head up into neutral. With his foot dorsiflex, he's going to extend his head backwards, and he's going to alternate his foot and his head. So if his head is extended, his ankle is dorsiflex. If he were to switch, he would put his foot into plantar flexion and bring his chin towards his chest. And then go ahead and do a couple of those alternating. So again, this is flossing the sciatic nerve all the way through from the proximal component down to the distal end. Another way that you can do this is to also have the patient supine and then just grabbing their leg into knee flexion again, and just dorsiflexing and cervically extending or flexing. And we can talk more about that in lab. Go ahead and relax. Next we have the femoral nerve, so it's going to lay prone, so lay on your belly. So again, we're going to start first with tension, so he's going to go into a press-up or cobra position. He's going to flex his knee up towards the sky, plantar flex his foot, and then if you were to extend his head backwards, that would be nerve tension, so it's on the most stretch it can be. If he were to nerve floss, if his foot is plantar flexed, he's going to cervically flex his head, and then he's going to alternate between cervical extension and dorsiflexion. So as he looks up, he's going to dorsiflex and then alternate between cervical flexion and plantar flexion. Good.